I always look through the agenda for this meeting, and I'm struck about the enormity of information that you get that is very much designed to help you do your business, to help you build this business, and how to function with a set of sort of new ideas and incredibly important things to help you do the work of being an emergency medicine physician. This is a little bit different in the sense that what I'm going to talk about today and then, or right now and then in a few minutes, is the idea of how we think about building ourselves and our teams into something that is highly functional, that individuals are able to come together to do things in a very intentional way, in a very high-risk environment, which is, of course, you in the emergency department. And I hope I'll be able to make the case about why I think this is so important. It always, when I think about my career and about the training, I'm always a little bit amazed about the amount of time that I took to learn, for example, procedures. You know, how many hours I spent thinking about procedural things, making sure I could do them, putting in a chest tube, how quickly I could put it in. I mean, I could probably do it in my sleep at this point, and sometime I probably did do it in my sleep. But when I think about how much time and effort I spent thinking about being part of a team, certainly for my training, it was almost none. The training that I got about how to be a good team member and how to be a team leader was actually in the military. So it's always been a little weird to me that the entity that is designed to go and kill people, we talk a lot about teams. The entity that is designed to save people, it didn't seem to be a particularly big deal. I'm happy to say I think that is changing, but I'm not sure it's changing quite as fast as we might like. I have no conflicts in this lecture or in the next. Lots of things I want to talk about. But I did think it would be kind of fun, since this was a little bit about leadership, is to kind of say there's a lot of theories about what makes good leadership. This is not a leadership course, however, but I think it is interesting when we talk about what it means to lead, is that there are all these theories to them. They're a lot of fun to read about. The idea of transformational, I'm able to lead people to do things far beyond what they ever thought they would do individually. Isn't that inspirational? Situational leadership, which is a little bit more about, what is the problem that you're trying to manage in that moment, and the way you lead in that moment might not be the way you lead for a very different situation. Many of you may be aware of the idea of servant leadership, which is very much the idea that perhaps when we think about the CEO being the top of the triangle, maybe we should flip it and put things like if you're in a business, customers, but certainly for us, put the patients at the top of that list, which means now we all are working to the benefit of that patient. I put this up here, though, just to touch on it very quickly, but also to remind you, there's a couple of things you don't see here on here. Like, there's no leadership theory that says micromanagement is a super good leadership style. There's not much about being a jerk, being a good leadership style. I haven't really found that. Even in the situational leadership, which is close as you might get to somebody saying, hey, sometimes you're brought in to do a system that is not doing well, and you're supposed to be the turnaround agent. Those people occasionally do kind of border on that, well, you're kind of a jerk. But sometimes that's the only leadership style they have. The organization gets past that crisis and that person gets moved out, because to continue forward, they need somebody other than that. So I'm struck by what is here, but I'm also struck about what is not here, because I think it's always worth a minute to have you just kind of sit for 1 second and say, who's a good leader? Like, have you seen a good leader? And I see that all y'all are so far back, you're little tiny people. I'm not sure you're going to be willing to say to me and shout out, what's a good leader? I mean, if you've had a good leader, what were some of the attributes? Anybody willing? Collaboration, transparency, innovative, good listener, flexible, outside of the box thinking, so just really not entirely limited in kind of what their thinking is. Sometimes when I say to people, give me an idea, well, shout out what's been a bad leader. Micromanager. Closed-minded. I think I heard something like a jerk. Not approachable. Narcissistic. Selfish. You know, it's funny, every time I ask these two questions back to forth, the good leadership, you sort of pull it from people. They're like, oh yeah. When I talk about the bad leader, people are like, bam, bam, bam. You know, it's an avalanche. You're like, that worries me just a little bit about what you've been exposed to. But it is, again, worth that moment. And then, of course, to ponder just for a second, what do you believe your leadership style to be? And then, of course, the most important question is, if that is what you believe your leadership style is, are you sure? Because many of you, we could have a long lecture about the ability for people to self-assess their own performance. That's quite fun. Turns out we're not very good at it. So anyway, that then begs the question, what is the idea of a good operational leader? And who then gets to wear the mantle of leadership? And we'll talk about that a little bit as we make our way through here. I'm always fascinated by the way people behave as leaders. My thought is that being a leader is actually pretty easy. My boss keeps disagreeing. We have a big debate about this. I'm like, come on. Being a leader to me is easy. I will tell you that the decisions of leadership can be excruciating. And that's really where I don't want to imply that, hey, it's a day in the park to be a leader. But how we behave as that leader is an easy choice in my mind. The decisions we make are incredibly painful at times, often resources, who's going to get what, which means there's winners and losers. But let's just kind of stop for a minute about the high-level leadership and just say, what is it that I do in the moment and certainly in the clinical environment? When people said, you know, what's an attribute of a bad leader that you've had, there was kind of this sense of unapproachable, hostile, potentially rude, maybe a little intimidating. And my question is why do you think people behave that way?
They're insecure.
Yeah, I actually think that is, you know, again, I think that's at least part of it. I think that, again, at least when we look at people, I am certain that there's people out there who really love leadership and the mantle of it, and they see it as this powerful, people have to listen to me. You know, the idea, if I just had authority over those people, I just believe that authority is wildly overrated, but that's me. But this idea that if I just could make these decisions, everything would be really, really good, and they look forward to that. I talked to a guy that clearly was having problems as a leader, and I asked him to explain to me a little bit about his approach. And as we dug through it, he actually said to me, and this is a compliance officer, so he was the head of a large compliance office, and he says to me, when I was a baby compliance officer, my boss did these things. And in particular, if the boss had a ham sandwich on Friday, everybody had a ham sandwich on Friday. And I'm like, wow, do you like ham? I was like, so wait, that's the lesson you took away from this guy's leadership style, is not that that's horrible, but that you wanted to be that? So again, I do think that sometimes we see people, you model at times what you see, particularly if it's your perception that somehow that was working. I think it's also fair to say that things have changed over time, and that maybe what was considered an okay leadership style in the past, we really find is we're not getting the best out of our people when we choose that particular leadership style. But I also think that there's something a little bit about, if you ask people what they believe, what is it that a leader does, and let's kind of put away that you're the boss of others. Let's just put that away for a minute. But perhaps some ideas around leadership is that you're now the leader and you're supposed to know what to do. You're supposed to have the answers, you're supposed to move things through, you're supposed to lead, and lead means in front, you know where you're going. Now, I always think that's so interesting because I happen to be in a residency program where I graduated and I stayed within my own program. So at, June 30th at 11 p.m. when I go home, I come back on July 1 at 7 a.m. because that's what you do to the new people. And last night I was a bug, and today I'm a monarch. And I was like, I walk in, I'm like, today I'm different. Can't you see it? And of course the nurses are like, yeah, right, sit down. I was in the military, so the nurses were so awesome. They just would put you right in your place. It was great. But there is this sense like, what is different this morning than yesterday? And you can imagine them when you're trying to make decisions and you feel like you're supposed to know what to do, and maybe you're not really supposed to ask for help or other questions. It can be, suddenly you're like, I'm intimidated, I'm a little insecure. And so again, there's a lot of reasons why people may behave this way, but I do think there are opportunities to talk to people, which I get to do quite a bit, about what they think they're achieving. But the problem is that if you're not really secure, then people ask you a question, and it sometimes is, are you questioning me? And then you start to get this sort of rude, hostile, intimidating, and we'll talk just a little bit more about this. I also think that people sometimes believe that they got what they needed in that moment. So in the operating room, if a surgeon snaps at somebody and says, I need you to pay attention, get me that instrument right away, certainly the person that they're working with is probably very attentive and handing things. That leader believes that behavior got them this important thing, but unfortunately, the rest of the team's performance tends to decline in those situations. Now, the rest of the team does not want to speak up, does not want to engage. So it is a little bit of this kind of game of how do I get what I need, how do I lead appropriately? But if we are intimidating and we don't allow communication to progress, or if we behave in certain ways that really dampens down the willingness of people to speak to you, the consequences can be catastrophic. I'm not going to spend a lot of time on the Martha Vineyards incident except to say that there was a captain that was very intimidating at that time. He absolutely would not allow people to speak up in the cockpit. Unfortunately, he suffered a heart attack and died while sitting up and well strapped in, and the co-pilot could do nothing. Did not realize he was dead, thought he was awake and just doing nothing, and of course the plane crashed. Hard to believe, right? There's an OR incident from 2007 where a very autocratic and intimidating ENT provider, who again yelled at anybody who spoke up, as in this case he was bringing the bovie up towards the airway, the anesthesiologist could see that the oxygen flow was still high. It needed to go down. He should have said, please stop, I need to turn down the oxygen. In this situation, he did not, and they basically set the patient's lung on fire. So again, the sense that if we cannot speak, at times it can be catastrophic. We know that these kind of hostile situations exist in various forms. This is sort of a 2003, you can go to 2010. I think you will find more and more that physicians, and anybody really that acts in this way, it is becoming increasingly unacceptable for that to be allowed. So you're getting less throwing of things and absolute screaming meltdowns, but there is still a good bit of just that hostility, that silent treatment, the sort of intimidation. It's just become more subtle. So it still does exist. So in the end, it's like, if I think that leadership is pretty simple, then I ought to make it pretty easy for people to say, so what does it really mean? And what could we set as expectations for leadership within our own systems, within our own small teams? You don't have to wait for the CEO of your hospital to wake up and say, I think teamwork is important and I'm going to hold people accountable to behaviors, particularly when they get to be called leader. These are things that are available to us every day, right now, in your own teams, in your own units, in your own emergency departments. And so there's 7 leadership strategies that I think are pretty easy. First of all is you could just ask your colleagues in a way that makes it easy for them to give you anonymous feedback, what kind of leader do you think I am? So you can see here that there's the idea that, down here you don't care about the task and you don't care about the people. That's pretty bad. There's this idea here that people really focus on being productive. So there's a lot of concern and focus for the task at hand, moving people through the emergency department, less concern for the team around you. Then there's somebody who's like super concerned about the team, but maybe isn't that concerned about the task. And then there's this idea here is that this is the grid where you would want to be. I do think you need to be a little bit realistic about here. Would I love to think I'm always a 9-9? Sure. Do I think I'm always a 9-9? No. And sometimes it's actually reasonable for you to move between those. The idea that you're doing CPR on somebody, you might not say, hey, would you mind pushing a little harder and a little faster if it doesn't bother you too much? Pretty okay to say, faster, I need you to do it this way. And then there's other times where it really is. I mean, hey, would you mind just kind of grabbing me something over there if you don't mind? Much more appropriate because it's not a big deal. So again, that sense of situational leadership is actually a thing, and it is actually appropriate, as long as you never go into the 1-1. You want to ask people what your leadership style is? Print that out, give it to people anonymously, and ask them to just slide it under your door. I would say, I always give it a caveat, is if I'm asking for feedback, I would like it to be constructively critical feedback. Just kind of being mean is not going to make me better, and it's not going to, maybe you'll feel better for a minute, but it's not going to help you make a better team. So then again, moving on from there, the idea of interpersonal skill. Believe it or not, NASA studied that being nice is a good thing. I won't belabor that point. But then you say, how do you be nice? Well, you greet your team. This is hard for me because I'm really bad with names. And I'm actually pretty bad with faces, so it's bad in every way possible. And then everybody comes in with a mask on, so all I can see is their little eyes, and I'm like, I have no idea who you are. So I'm sort of like, hey, why don't you introduce yourselves? Again, the idea of being polite, setting the tone. There's a lot of discussion in teamwork and team training about, can I, is it okay to use first names? I will encourage my team, my immediate team, to use my first name. And that's because I'm old now and I just don't care. For younger providers, particularly young women, it is very reasonable for them to ask to be called a physician, because again, a lot of times there's not a recognition of where they are because they do look young. And this can be men and women, but particularly sometimes young women. Make the eye contact, again, good sort of nonverbal communication. Then there's how do we build teamwork? Again, now we go on, invite and expect participation. It's funny, it's all how you say this. If I say, hey, please speak up, they might. If I say, I'd only be disappointed in you if you didn't speak up when it was really important, particularly for a patient, very different. And now you will get people to speak up. It's also the idea of, is there areas that I can ask a more open-ended question rather than always directive? This is not, I don't think about this every second of the day. I just, to be clear, I'm not like, oh my God, am I saying it right? It is the intentionality of knowing the moments at which this is best used. But certainly the team in the emergency department, from my perspective, I'm like, there's a lot of nooks and crannies in this emergency department, and if I can't be everywhere all at once, if you think there's a concern, please come get me. If you have a concern that I'm doing something that just doesn't seem right, please, we're here to take care of patients, let me know. There's also the idea of sort of closed loop communication. So the important idea of if I get a phone call with a potassium for Mrs. Smith is, 8, I will often read that back just to confirm potassium, Ms. Smith is an 8. If you're the only person who does that in your room, and again, in the military, this was just sort of the way you did things. I came out of the military, and I did this a few times at my first academic job, and I have to tell you, one of the nurses thought I was mocking her, so we had a long conversation. I'm like, no, it's just closed-loop communication. So it is helpful if more than one person does it, just saying. Again, briefings. Now, in the emergency department, it's sometimes really hard to sell this one about the briefings, sort of, first of all, it's busy, I don't have time for this. And again, this is not in every single patient thing, right? This is the patient that maybe is coming in, and here's what you know about the trauma or the EMS thing that is coming in. Initiated by the leader of that particular event. Or I'm going to put in a central line. And this allows me to make sure everybody knows what we want to accomplish in this moment. It is very short. It is guided by a checklist. And so the ideas here is just as simple as this. Greet the team. What are the goals for this particular thing? We're going to put in a central line. What are the rules? Let's make sure it's the right patient. Please keep me sterile, yada, yada. Any roles if you need them. I love expected threats. This woman is already pretty dyspneic and short of breath. Her SATs have been marginal. They've been a little bit better, but I'm now going to put her underneath a bunch of drapes, and I'm probably going to put her a little bit in a different position. I need you to keep track of the oxygen saturation, because how often have people been like, I'm short of breath, and we're all like, just a little longer, almost done. So now you really need somebody who's like, no, Robin, the SATs are 75. You got to stop. And again, that last thing, are there any questions? Super quick, right? This is not a long thing. You can do this in about a minute, if that, especially after you practice. And then the idea, again, about a debriefing. Again, initiated by the team. Many of you do this already, and there's places that have really built this in. If there's a code and the patient does not survive, that's sort of honoring what we know about the patient. But there's still an opportunity there to talk for just a few minutes about how did everything go here? What went well? What didn't go well? There is so much learning there. Did we have what we needed? Did it work? Have you ever had a code, something didn't work, and you come back 3 hours later, and guess what? It's still not working. And that's because we never discussed it and we did not assign it to anybody. So, 7 things, right? Anything on there seem absolutely insurmountably difficult to be a leader? You can come tell me afterwards, I can't do that. Now, the next thing then is this idea of assertive advocacy. Also, we call it followership. So there's leadership and there's followership. I love using the word followership because it tends to be, people get a little offended by that. They're like, who you calling a follower? We'll have a little bit of a conversation about that in the next session. But the idea here again is, if I say to you, what do you want to see in an effective follower? And the list is, this is not an all-encompassing list of what you might see in a follower, but it's a pretty important list. And the thing here that I look at is I want them to be engaged. I want them active in decision-making. I want them to be a critical thinker. I want them to take ownership and responsibility. I want them to speak up when necessary, regardless of rank and title and position and hierarchy. I don't know about you, but I have found that the hierarchy is invisible but incredibly weighty. People know where they are on that hierarchy. And the further down, it is weighty. They feel like the decisions, the ability to speak up, putting their hand up, sometimes they believe put them at risk. Their careers, their assessments, their evaluations. To me, being a follower is really where courage lies. Wherever you are in your organization now in a hierarchy, I'm pretty confident that there's somebody's office that you might want to go to have a difficult conversation, and you will be a little sweaty, a little nervous, and kind of worried about how it's going to go. And maybe you never even feel like you're able to say what you want to say. And yet, we ask followers to do this. I sometimes put that list up right after the leadership portion of this, and I say, do these seem like behaviors of a leader? And everybody kind of goes, yeah. And then, of course, I put up that this is an effective follower. Because again, this is also known as leading from below. Whole books on that, But it is hard. It is incredibly hard. If you've ever, had somebody come to you and say, I have a clarifying question. I'm like, okay. And then a little bit later, they have another clarifying question, and then another clarifying question. And I'm like, I don't understand why everything is a clarifying question. We're trying to be a lean organization, right? So what's the extra word for? Isn't it just, if everything is a clarifying question, isn't it just a question? So then why are they asking for it's a clarifying question? And understand that's because they don't want to be perceived as questioning me. It's not you I'm questioning, it's me. I kind of know what I want you to do, but I just have a little bit of a clarifying question. So much time and energy and waste in all of that because people can't just come up to me and say, hey man, I have a question. Do you want it this way or that way? Or I have a question because I'm a little bit concerned about that way. And we just waste so much time and energy. And we ask people to do this, but as leaders, sometimes we're not prepared for them to do this. So it just kind of as this sort of last thought here is that what it is that we think about when we have the people that we work with. Certainly I've had followers that I know they're unhappy because I can see them milling around sort of making sheep sounds, but they'll ultimately kind of unpleasantly do what you ask them to do, even though they all think it's the wrong thing to do. Then, of course, I'll leave that guy to last. I like the ones who at least they roll their eyes at me so I know they're unhappy, so I can at least say, come on, what's the problem? Obviously, this is what we want. If you really think about golfers, the caddy isn't just there to schlep their golf clubs around. They're actually there because they know that golf course, in many cases, better than the golfers, and they can give advice and participation. But if you yell at them, they're just going to sit there and say, you paid a lot of money and your golf course thing's going to suck. Now, this last one, though, is the one that these people are actually, they're quite dangerous. You're like, okay, I see that you're going to cut off the wrong leg. That's fine. I'm going to help you do it with a super sharp knife. All right, I'm making fun of them. But they are sometimes a little overly eager to help you do absolutely the wrong thing. Not super helpful. And if you know you have somebody like that, it's actually worth sort of sitting them down and saying, you know, you're not going to get ahead by helping me do the wrong thing. Usually. I'm sure there's people that have gotten ahead doing just that. This is what we call the followership algorithm, and we will touch on the most basic of that in the next session, the 3 Ws. But it is clear that, you know, there are these stepwise things. So if I ask people to kind of do this and act in this way as a follower, and they get sort of pushback, ridicule, they just can't do it, there is this escalation where sometimes you get through the situation the best you can, and then you use your hierarchy to help sort of clarify what you expect from the entire team in the future. But in the end, you know, trying to sort of do this and build this is it takes time. And I think that's where sometimes we have to make a decision to be intentional. Is it worth building a team that acts in a way that together you make your system certainly safer for your patients and actually a little bit better for you? It doesn't mean everybody flows up faster. It does mean as a team, your day goes a little bit better than it might otherwise.